this week I thought I'd start with an actual update because I always say that there's an update, but I really don't talk about what's going on in here. So this time, it's been 13 weeks. So it's been like 1 month because it's the beginning of September and I got my surgery at the beginning of June. So I started working like 4 weeks ago at week 9, and then I think that my swelling, basically between week 7 and week 9, my swelling decreased a lot. And then once I started working, I was like, okay, it's back. And then it just never went away. So I feel like in here, that swelling is going to just take, I don't even know how long, like 3 more months, 6 more months, whatever it is. It's fine, but definitely it comes back when you start being active, like actually active and needing to, walk and talk all day long. So yeah, my swelling's back. And then you can see these awesome new rubber bands. So the difference between this and what I had before is that this V used to be on this tooth, so it really looked like a V before, and now it's like a slanted V. So when I'm wearing like red lipstick, seriously, I totally look like a vampire, which I don't mind, but it's just kind of funny. So this I got like a week ago. I don't think it's gonna go away for at least another 3 weeks when I go back, and probably he's gonna just keep them on me, which I guess is fine. The only problem is that they snap off while I'm working, and then I don't have time to put them back in, or I forget, and then they don't go back in until like 5 or 6, and then yeah, so that's not so good. Okay. Otherwise, pain and things like that hasn't really changed. I still have to wear silicone and wax in there because I think especially with the swelling coming back a little bit more, um, it hurts even more where my bracket is touching like the inside of where the stitches used to be. Okay, so there's that stuff for the update, and then I wanted to talk about the actual surgery today. So I think last time I left off with like the day before or something. So what I also did the day before is I went in and I went into the hospital and like pre-registered or something like that. So it's like a early check-in. So that took longer than anybody expected. I don't know why, but it took like an hour and a half instead of like 30 minutes. So everybody got all weird and freaked out about it because it was supposed to take a certain time and I was supposed to go back to my surgeon's office, but it took forever. Nobody knew where I was. People were really confused, but it wasn't my fault. And okay, so that was like a easy thing. They just took forever. So the morning of the surgery, I was scheduled for 7:30, and then I got there at 5:30. So they told me to get there really early. I did. It was really fast to get like checked in that morning. The only thing was, I think the lady was having a hard time with my secondary insurance, so the insurance that I was getting through my husband's work. But that, kind of settled itself. It was fine. I went into the pre-op room. They changed me. They put in an IV, and then I actually still have that little mark right there because it's kind of big. It was like a big needle, and then they stick in this plastic IV tube. Um, so it didn't feel good. I don't really mind like needles and things like that, but that one definitely hurt, especially in the beginning. And then we just kind of like, me and my husband just hung out in there. There was nobody in there. Oh, they gave me a pregnancy test to be like, let's make sure you're not pregnant before the surgery. And then that's it. We just like sat around. Nobody else was in there. And then I think the anesthesiologist was supposed to come at like 7. At like 7:15, my surgeon comes in, and he was surprised that I hadn't met the anesthesiologist yet. So the surgeon was much more like down to business when I saw him at 7:15, which is totally fine. He seemed like ready to go into surgery, basically. So he came in, talked to me for a second. He left. Probably around 7:30, the anesthesiologist gets there and he introduced himself and he was really nice. The only weird thing was he was like, "Oh, how are you feeling?" And I go, "Oh, I'm kind of nervous. I've never gotten surgery before." And he goes, "Well, just know that God is looking down at you when you're in there." and taking care of you. And like, I don't know how to respond to something like that. Like, not to say that I don't believe in God or anything like that, but man, just don't say things like that. Like, you don't know me, don't say that. That's just annoying. So, but it was fine. So he left. And then probably around 7:40, they put me into a rolly bed, and then they started rolling me into the OR. I was fine. There was no crying, no tears. I just, said goodbye to my husband. And then, okay, the OR. I totally remember the OR. Like, when you go into, or when you see an OR on TV, it's pretty small. And there's like, 3 or 4 people in there, right? I mean, it doesn't look big. Um, it looks the size of like a small bedroom or something like that. So this OR was so big. I remember I got rolled in and I was like, whoa. So like it's huge. It's probably like the size of my living room, which isn't like huge, but it was just so big, and there were so many people in there. There were at least 10 or a dozen people in there, at least, on the walls. It was like totally bare, except for like one giant wall of like lights and like all these x-rays on the walls. I've seen that before on TV. And then they roll me under this big light thing with like, it's like 3 lights. They're like, a triple thing of circular lights. And it reminded me of any scene where there's like an alien abduction, because yeah, once they turn those lights on, you're like, oh my God, like it's just crazy. So all I remember really is I got rolled into there and I thought it was crazy. And then the doctor, he wrapped like a towel around my hair, and then he taped up the towel to my head, right? Like along this area. And then once he did that, the anesthesiologist came and was like, okay, I'm gonna give you something to help you relax. You're probably gonna fall asleep soon. And I was like, okay. And then as soon as I said, okay, bam, I was gone. So there was no like counting back. There was nothing. It was just, and then asleep. And then I woke up. And I remember waking up and I was like a little groggy. And I knew that I had surgery already, because like I couldn't move my jaw, but it didn't hurt. Like nothing hurt. I could kind of move it. I think I was like, it's just terrible. But you're like groggy and stuff. And then I think I went like this. And then there are 2 nurses in the after surgery ward, and they're like, oh look, she's awake. So they come over, they look at me, and then they walk away. And I was probably in there for like a good 30-45 minutes. All I remember was I really wanted these ladies to talk to me, because I had nothing to like do in there. And I was totally like, more and more I was totally alert, and all they did was talk to each other. So I'd be like I just, I wanted them to come over, and so they'd come over and still be talking to each other and be like, she's doing fine, and then like walk away. So at one point, I think when they came over, I was like, my mom is a nurse. And then, the old lady was like, oh yeah? I go, yeah, she's in labor and delivery. And then I tried to engage them, but they were just not into it. And then probably, after about 45 minutes, they got a call. And they're like, oh, you have a room. And then so they told, I don't remember what number, but they told the guy who was rolling me, like, oh, she's going to go to this room. So then they started rolling me. And I think at some point, like, my dad and Frank, like, came next to me because they were, like, waiting outside, right? So then as we were rolling to that first room, somebody goes, oh, she's going to this room. And somebody else is like, no, she's going to this other room. And then they go, oh, lucky girl, you get your own room. And I'm like, okay, sweet. But I didn't really believe it until I got there. And then I got there and I got my own room, which is like really, really uncommon, I guess, at that hospital. So that was really nice. If you can somehow manage it, man, get yourself your own room. I don't know how that happened. Maybe just because it was like going to be an overnight thing. So like, you get like priority for an overnight room that's by yourself or something. But I was happy in there. Much easier on, like your relatives and stuff. When they come to visit, they can just sit anywhere. They don't have to worry about bothering the other person. And then you get your own bathroom too, which is nice. Okay, so I was totally alert. Like in that room, I remember I was texting and I was like texting my friends and like, oh, I feel great, da da da. Like I was just so alert. I felt like I was talking like this, and then my dad kept telling me to stop talking, and like everything was fine until like 6. And then around 6, and they tell you, okay, so before the surgery, they tell you. After the surgery, they tell you like 3 different times, 3 different nurses and doctors will be like, I don't know about the doctors, but the nurses definitely, they're like, when they ask you what your pain level is, you need to, be honest slash exaggerate. Like, don't say it's a 3 if you're at a 4 or a 5. Like, you want to um, emphasize your pain. And I'm like, okay. So in the beginning, they asked me, and it was probably like a 4. And I was like, oh, I think it's like a 6. And then at some point, that 4 turns into a 6. And then I say 7 instead of 6. And then, you know, I think around like 6 p.m., then it really started to hurt. Probably the anesthesia was wearing off or something, even though I was so like active. Like my brain was totally working, it was fine. And then at some point it really started to hurt. It probably by like 9 p.m. it got up to like an 8. They gave me some sort of like they gave me 2 shots, I remember. One was steroids and the second one was hydrocodone. So for whatever reason, the combination of what was already in my system and those 2 shots, it felt awful. It felt so disgusting. Like I felt like through there I could feel this tingly medicine, and it wasn't tingly in a good way. It was like so uncomfortable, like my skin was crawling out of me and the pain didn't go away. So I think they can only give you like a certain amount of medicine every however many hours, right? So they could also give me morphine. So I think they gave me morphine at some point, and then they could only give it to you like once per hour. You get like 1 milligram per hour or whatever it is. Um, but it started to really hurt. And when you call the nurses, I mean, they're busy. They don't come right away, right? So even if it's been an hour, like, and you call them, then it's it's going to be another 30 minutes before they come, or 40 minutes, or whatever it is. And when you're in pain, that's a long time. So at some point, I want to say at like 10 p.m. or something, the pain was so bad. And like I said, I'm pretty good with pain, but I was crying and I was just not having it. And so I was so lucky that my sister was there. So my husband was there, and I love him, but my sister is a little bit like overbearing. And in this situation, she totally saved me. So she also kind of works in the healthcare industry, and she got the night nurse to call the doctor and then ask for a morphine drip. And the doctor was not really into it. So then my sister actually talked to the doctor for like 10 minutes, and the doctor was nice and my sister was nice, but she basically just kept emphasizing that I've never been afraid of pain. Like this is serious pain that I'm in, and I need at least once an hour of morphine or more, because I couldn't handle it. I was crying the whole time. Um, and then he agreed. So I guess out of his whole career, and he's going to retire soon, I was the very first person who he had ever written a morphine drip prescription for. So I don't know if it's because, I just had worse pain, which is crazy to me. I don't think that could be true. Or, he really realized that, okay, this is serious, and, even just a few hours of this is really going to help me. So they ended up putting a morphine drip in my room. I think so instead of 1 milligram per hour that the nurse administers, it was 1 milligram per hour that's continuous. So it was very slow but continuous. And then I could also press a button that would give me 1 milligram every 15 minutes. So if it was within the 15 minutes, if I pressed it, nothing would happen. But after 15 minutes, if I pressed it, then they would give me, more morphine. So that finally let me sleep. That probably got put in around midnight, and I remember I'd wake up like every hour. I don't know why. I was wearing like something that would take my blood pressure every hour, so I think that's why I was waking up. But other than that, like I'd wake up, I'd feel a little bit of pain, I'd press it, and I'd go back to sleep. I think it took like that initial milligram plus like two more for me to really not be in pain. And then after that, I just needed like one more click per hour than they were giving me automatically. And then I woke up around, I would say like six, like 5 or 6 or something like that. Like I was waking up every hour, but I actually woke up around then. Um, Regarding the nurses, I've read that sometimes like night nurses aren't as awesome as the day nurses, and that was not my experience. So my first nurse was fine, totally just fine. The night nurse was so like the fact that she really saw the pain in my eyes, and she called the doctor and she really cared. Like I was in and out of consciousness and I was totally loopy from the drugs, but I would listen to her talking to my sister and my husband, and she just really cared about her patients. And then the next morning, the day nurse, I was not a fan of. Like for sure, that one was the worst nurse. Um, the other two like fine and awesome, and then the last one was not amazing. You could tell she was like faking it in front of the doctor, and then yeah, so I wasn't into that. But anyway, so that was my general experience with the surgery and with the immediate aftermath. And the next stuff we can talk about later. Hopefully I record within like another month or something. We'll see. Okay, I'll see you later. Bye guys.